Hi, good evening. Today we will talk about how to approach anemia. Basically, this is for those candidates who wants to appear for a written MRCPCH exam. So when you examine a child with anemia, the first thing you have to do is you are looking at the hands, and then finally you are looking at the eyes. So if the child is pale, like conjunctival pallor, then the problem is in the bone marrow. So the common causes of anemia is iron deficiency anemia, folic acid deficiency anemia, or aplastic anemia, or some bone marrow suppression. And if child is not pale, but child is just jaundiced, so what does that mean? Is the problem is the liver. So child has some sort of hepatitis. And the third scenario is child is pale and jaundiced. So in this case, the problem is in the red blood cells. So this is how you have to approach to the patient with anemia. So in our case, if it is the problem in the bone marrow, you know the reasons, very simple. And if it is the problem is in the RBC, then here you have problem. You have to sort out the make the differential diagnosis. So RBC has two parts: is a cell membrane and cytoplasm. In cell membrane, these two diseases is G6PD deficiency and spherocytosis. While inside the RBC is cytoplasm, we have two diseases: thalassemia and sickle cell disease. If you combine all these four diseases, we call them chronic hemorrhagic syndrome, which is very important for your clinical written exam as well as for clinical exam. So I'll give you four scenarios for these four chronic hemorrhagic syndromes. So we have a child who is pale and jaundiced with hepatomegaly. And the second scenario is we have a child who is pale and jaundiced with splenomegaly. And my third scenario is we have a child who is pale and jaundiced with hepatosplenomegaly. My fourth scenario is we have a child who is pale and jaundiced but no hepatosplenomegaly. So these are the four scenarios you have to make the diagnosis, written as well as clinical. So a child with pale and jaundiced hepatomegaly is sickle cell anemia. So in sickle cell anemia, this mild hepatomegaly and this autosplenectomy, so you can't find the spleen. My second scenario was pale jaundice and splenomegaly. So in this case, the diagnosis is spherocytosis because spleen has to work hard to remove all the dead RBCs. So you have massive splenomegaly. And our third scenario is hepatosplenomegaly. In this case, in sickle cell, in thalassemia, there is severe anemia. So your both liver and spleens are enlarged. So you have massive hepatosplenomegaly. In fourth scenario, the child is pale and jaundiced, but no hepatosplenomegaly. What does that mean? This is intravascular hemolysis. So the two common cause of intravascular hemolysis is G6PD deficiency and some hemoglobinuria. So in our case, this is G6PD deficiency. So this is how you have to approach. The other way to approach is ethnicity. If the child is pale and jaundiced and is from South Asia, the diagnosis is thalassemia. And if the child is pale and jaundiced and from Africa, is sickle cell disease. And if the child is pale and jaundiced and Caucasian origin, is spherocytosis or pyruvate kinase deficiency, and the child is pale and jaundiced and from Middle East is G6PD. So these are the common scenario. The other way is, look at hemoglobin. Normal hemoglobin is 13.5. So if you have a child with hemoglobin of 11.5 is straight. If the hemoglobin is 9.5 is spherocytosis. If hemoglobin of 7 is sickle cell and hemoglobin of 5 is thalassemia, because that's what we are aiming for in these cases. So this is how you have to approach. The other thing is in written paper is if hemoglobin is low, retics are high, MCV is high, then this is sickle cell disease. If hemoglobin is low, retics are high and MCV is low, this is thalassemia. If the hemoglobin is low, retics are high and MCHC is high, then this is a spherocytosis. At the same time, if the hemoglobin is low, MCV is low, RDW is high, is iron deficiency anemia. So this is how you can approach to the patient with anemia. In my next session, I'll explain more. Thank you.